So one of the most uplifting findings that we've had is that patients and family members want to know what their prognosis is. They want doctors to be honest with them. They don't always want it, but sometimes they want information about how long they have left to live. We find 72% of the time when we ask patients, if a doctor knew how long you had left to live, would you want him or her to tell you? And we find that 72% of our patients say yes, but only 17% say that their doctors had discussed their prognosis with them. So it's sort of the elephant in the room. So one piece of advice we have for families is to ask their doctors specifically how long they expect the patient to live and how long what they need to plan for. And a lot of oncologists in particular are very reluctant to discuss a number, even a range. So if something, oh, don't give a number, they're going to hold me to that number and I have nothing to gain by being that specific. They don't even want to be giving a range. But one thing that we have another paper coming out on is that if they can say months, not years, patients and families get that. It doesn't have to be to the day, it doesn't have to be to the month or week, but it does have to suggest months, not years left to live, because that changes your whole ability to plan for what's likely to be ahead. And it's not going to be the news that a lot of patients and families want, but to deal effectively with their situation, they need to know. They need to ask and they need to know. So we recommend that patients ask their oncologists what their prognosis is. We also recommend that patients and families ask their doctors, what are the likely side effects and outcomes of this treatment? When you say that I might live significantly longer getting this drug, what are the data? You know, how much longer are we talking about? A week? A week of what? A week of being intubated? Do we know what intubation means? You know, so when patients understand what intubation means at the end of life, so not signing a do not resuscitate order and being intubated, you have a breathing tube in your throat, so you're usually sedated because your body rejects having that tube in your throat. You usually can't talk, you can't eat for yourself, so the quality of life of that patient being kept alive by these machines is really minimal. So if that's not recognized as an important aspect of the care plan and planning ahead so that patients know what to expect and what they're getting, then doctors are failing their responsibility to have informed decision making with their patients and the families that they care for.